Hello everyone, and welcome back to episode 4 of Ethical Dilemmas. Today we tackle a question that tests the boundaries of medical ethics. Is it ethical to force treatment on a patient with a mental illness? Joining us once again is Dr. Marcus Fields, a renowned bioethicist, and Dr. Eric Jones, a practicing psychiatrist with extensive experience in mental health care. Let's get started.
Thank you for having me. This question is at the intersection of autonomy and beneficence. We have a duty to respect patient autonomy, but what happens when mental illness impairs a patient's ability to make informed decisions?
Exactly, Dr. Fields. Take, for example, a patient with severe bipolar disorder who, during manic episodes, refuses medication and engages in reckless behavior. They might be putting themselves at significant risk. Is it ethical to intervene forcibly to prevent harm?
That's a critical issue. The ethics of intervening forcibly revolve around the principle of beneficence, which emphasizes acting in the patient's best interest to prevent harm. In cases where a patient's decision-making capacity is significantly impaired by their mental illness, and their behavior poses a serious risk to themselves or others, forcing treatment can be justified. However, this intervention should be viewed as a temporary measure aimed at stabilizing the patient. The goal is to address the immediate risk while working towards re-engaging the patient in a therapeutic relationship. It's crucial that such decisions are made with careful consideration of the patient's overall well-being and involve ongoing efforts to restore their autonomy as soon as their condition allows.
That's a compelling case. But let's add another layer. What if this patient has a deep-seated belief that their manic episodes are a form of divine intervention, and treatment would be interfering with a higher purpose? How does that impact the ethical considerations?
That's a tough scenario. On one hand, respecting their religious beliefs is crucial. On the other, their safety and well-being are paramount. In practice, we often try to address these concerns through a combination of respect for their beliefs and clear communication about the risks involved.
Indeed. And what if we consider another patient with obsessive-compulsive disorder who insists on performing rituals that severely disrupt their daily life? They might refuse treatment, believing that these rituals are essential to their survival. Here, the question arises, is it ethical to override their autonomy to relieve their suffering?
In OCD cases, the rituals are often driven by intense anxiety. While the patient might see these rituals as necessary, we know from experience that effective treatment can significantly improve their quality of life. The challenge is balancing respect for their perceived needs with the practical benefits of treatment.
Let's introduce a different condition. What about a patient with schizophrenia who experiences paranoid delusions and refuses antipsychotic medication, believing that the medication is a government conspiracy? This patient's delusions are causing them to act erratically, potentially endangering themselves and others.
Schizophrenia presents a particularly challenging ethical dilemma. The patient's lack of insight into their illness complicates their ability to consent. Here, the ethical question becomes whether we have the right to intervene for the greater good, despite the patient's apparent wishes.
And in cases like this, it's crucial to consider the patient's capacity to make informed decisions. We often involve legal and ethical consultations to determine whether the patient's refusal is a result of their illness, impairing their judgment. It's a delicate balance of autonomy versus protection.
Let's add another dimension. Consider a patient with severe depression who has a history of suicide attempts. They refuse treatment, expressing a wish to die. Here, we face the challenge of respecting their autonomy while also intervening to prevent what might be a preventable death.
This scenario raises profound ethical questions. Philosophically, one might argue that respecting a person's wish to die could be seen as acknowledging their autonomy. However, from an ethical standpoint, if the depression is impairing their judgment, forced treatment might be justified to preserve life.
In these cases, we often need to consider the patient's capacity to make informed decisions. If the depression is clouding their judgment, intervening might be seen as an act of compassion, aimed at helping them regain clarity and make better decisions in the future.
How do we address the philosophical aspect of suffering in this context? Some argue that suffering has intrinsic value and can be a profound part of personal growth or spiritual development. Does this argument change how we approach forced treatment?
Philosophically, suffering can indeed be viewed as having value. However, in medicine, our focus is often on alleviating unnecessary suffering. When suffering is a result of untreated mental illness, It might be seen as a case where intervention is justified to reduce distress and improve the patient's overall well-being.
I agree. While suffering can be meaningful, when it is the result of a treatable condition, the ethical imperative shifts towards alleviating that suffering. The goal is to help patients reach a point where they can appreciate and make use of their experiences more fully.
As we wrap up, it's clear that the question of whether it's ethical to force treatment on a patient with mental illness involves a complex interplay of autonomy, beneficence, and individual circumstances. The current ethical stance emphasizes a balance, respecting patient autonomy while ensuring safety and well-being, especially when mental illness impairs judgment.
Indeed, and this balance is not easy to achieve. Each case requires careful consideration of the patient's capacity, beliefs, and the potential benefits and harms of intervention.
Absolutely. It's about navigating these difficult situations with compassion and a commitment to the patient's overall well-being.
Thank you, Dr. Fields and Dr. Jones, for your insights. For our viewers, we encourage you to continue this discussion in the comments below. Share your thoughts, experiences, and opinions on this challenging ethical issue. If you found this debate thought-provoking, subscribe and follow for more discussions that make you think deeply about ethics and medicine. And remember, in the realm of ethics, every question is a gateway to deeper understanding.